I will not be able to, help everybody with their specific issues with their child. And if you are really struggling with tantrums and meltdowns, including aggression and self-injury, I would definitely encourage you seeking someone to help professionally, and I'll have some information at the end about how to find somebody if you're having trouble. And in the meantime, what does meltdown mean to you all? What does it mean when somebody says, oh, he's having a meltdown? What does that describe?
Sagging out.
Yep.
Emotional release.
Emotional release, acting out, screaming. What else? Yep.
Being out of control.
Out of control. What kind of behavior do you see from your kids when they're having a meltdown?
On the ground.
On the ground.
Throwing stuff.
Throwing stuff. Aggression. Yes, those are absolutely some of the most common answers. In the literature, they have funny definitions in some places. Some places they just describe it by the behavior. There's a couple places it's inappropriate behavior paired with negative emotional reactions, or explosive and out of control displays of emotion. All of those things I'm going to talk about today as tantrums and meltdowns, and I'm going to kind of use those two words interchangeably. I know for some people one means something and the other means something else, but today we're going to kind of talk about it all together. Okay. So, tantrums in and of themselves are common in children. If you look at the literature for preschool children, the estimate is that somewhere between 50 and 90% of typically developing preschool children have tantrums that are impacting functioning. Typically, those fade out as children get older and learn skills to better control themselves, control their emotions, communicate with people around them. Lots of times our kids on the spectrum have trouble with some of those things. So for children with autism, they typically have more tantrums than typically developing children. They have more tantrums than children who just have a language disorder. And they have more tantrums than children who just have ADHD. And symptom severity, so how severe the symptoms of autism are is related to how severe the tantrums are. So more severe symptoms of autism is related to more severe tantrum behavior. Also, tantrum behavior can be related to other things like mood issues, like anxiety and depression. Tantrum behavior can be related to struggles in school, can be related to struggles getting along with other kids and other people in your environment. So it's something we really want families, providers, other caregivers to have some strategies to better handle. So I'm showing you guys this picture of this iceberg because the top of it, the part above the water, is what we're really seeing. I want you to think about that as what you see when you're seeing a tantrum. You're seeing screaming, you're seeing dropping to the floor, you're seeing throwing. That's above the water. That's the visible, obvious piece. That's the part where like, oh, please stop, I need this to go away. There's a lot of stuff underneath that's going on with your kid that may be causing these behaviors that you see above the surface. And I want us to spend some time thinking about what might be going on underneath the surface, and understanding that piece better, the part below the iceberg, is going to help us figure out how to better manage it and what to do. So, actually, I'm going to ask you guys, don't cheat. What are some of the things under the iceberg, below the surface, that you think might be causing tantrum behavior, making tantrum behavior more likely? Sensory issues, absolutely, that can be an issue. So maybe your kid's really sensitive to loud noises, or maybe your child, really hates certain textures or tastes. You had one in the back.
Communication deficits.
Absolutely, this is a huge one. Not being able to communicate your basic wants and needs is going to make you easily frustrated. It's going to make you have trouble navigating your world. If you can't say, oh my gosh, my diaper's dirty, or I'm exhausted, or I really need something to drink right now, I'm super thirsty, that's going to make your world harder. So that's definitely a piece of what's going on underneath the surface. Anything else?
Transitioning to other activities.
Huge, huge. Transitioning, especially when it's unexpected or you don't know what's coming next, that absolutely is something that can lead to tantrums.
Social interaction.
Another big important one, yes. So sometimes social interactions are really hard for our kids on the spectrum, and just having to engage with someone else can lead to some of those tantrum behaviors.
Not being able to finish a task.
Yes, need for completion, or to complete a routine, or to do something the way that you know in your head it has to happen. Sometimes if that's disrupted, whoa, that's going to throw me off big time. Okay, so those things that you guys mentioned, some of them are directly related to the symptoms of autism. Those communication deficits, those struggles with peer relationships and other social interactions, those things are core features of autism and kind of tie on pretty directly to why we might see tantrum behavior. Also, those issues with sensory stuff and preference for routine and sameness, you've already mentioned. There are other related issues that often also can lead to tantrum behavior. A lot of our kids with autism also have some kind of developmental delay in some area. That might mean it's really frustrating for me to tie my shoe. I'm supposed to be able to do it. I can't. I lose it. Also, sometimes our children with autism have trouble regulating their emotions. They're not very good at doing that independently, and that can be a big problem. Anxiety is a huge one, often seen in children with autism, as well as inattention, impulsivity, and sometimes struggles with processing speed, just needing a little more time. If somebody's rushing me and I have slower processing speed, that might not go so well. So, we've already outlined this to some degree, but what you're seeing on the top are those behaviors like dropping to the floor, screaming, refusing, hitting, but it may be very clearly related to all this stuff underneath that we are not always thinking about. So when I'm trying to help a family think about managing behavior a little bit better, I want them to think about the ABCs. I bet a bunch of you have heard this spiel before. This is probably not that new, but it's important for us to really take a little bit of time to think about the antecedents, what's happening before you see the behavior. What's the behavior? What are we targeting? What are we working on? Is it yelling, or is it throwing, or is it, I don't know. And what is happening afterwards? What are the consequences? Where we have the ability to change things is here and here. We can change some of the antecedents. We can change some of the situations that might lead to tantrum behavior sometimes. And we can definitely change some of the consequences that are happening afterwards. And by changing those two things, we are able to make tantrums happen less often or be less severe. And that's our big goal. So I'm sure somebody might have said this to you at some point too. Taking some data about what you're seeing with your child can be a really valuable tool as you're trying to figure out how to help them, as you're trying to figure out what's going on, why are we having these tantrums, and what do I need to do about it. I'll give you a short example. I worked with a 4-year-old boy for a while, and he had some okay language skills actually. He could have a little bit of a back and forth conversation with you. He had some okay play skills, and he had been doing pretty well behaviorally for a while. And all of a sudden, he had this huge shift, and kind of out of the blue, he was screaming, hands over his ears, dropping to the floor. And several of us who worked with him, including his parents, we couldn't figure out what was going on. Like, it just wasn't obvious, it wasn't clear. And so we said, okay, we better take some data, because I don't know what's up, I don't know how to help. I don't know how to do anything about this. So we took the data, and after, it didn't take very long, a few days, maybe a week, it became obvious that as soon as one of us asked him a hard question, like, what'd you do at school today? Or, where do you want to go next? That was a trigger. Set him off. He hated those questions. But because it was just part of everybody's kind of daily, what we do with this child, we couldn't figure it out. We had to take the data to see, oh, ask a question, hands over the ears, drop to the floor. That helped us figure out what we needed to do. Because we want what we're going to do to be related to the function, to why the child is having this difficult behavior. And sometimes taking this data, looking at the day and the time, what's going on beforehand, what's going on after, can help you see a pattern that's hard to see otherwise. I've had plenty of parents come in and say, well, it's every time I say no. And that's tough. You have to say no sometimes. That's not really clear. That's tricky. So lots of times I'll be like, okay, we got to take some data. Is it when you say no, like you have to finish an activity that you like right now? No, you can't do that anymore? Or is it when you say no, we can't play right now. I can't play with you right now because I have to cook dinner. Those are two different no's. We got to figure out what's going on there. So taking data can be a very critical part of determining the function. And I'm going to talk about function a decent amount. That's, to some degree, the why. There are 4 common functions for behaviors, not just for our kids on the spectrum, but for all behavior. Oftentimes, we have behaviors because we want social interactions. And when I say behavior at this moment, I mean both positive and negative behaviors. Both like, oh, hi, how are you today? And I'm throwing something at you because I want you to look at me. So attention can be a common function. Tangible, that just means a thing, access to something. And it could be an actual thing, like your phone or an iPad or Thomas the Train Engine. It could be a particular activity. I love peekaboo, and I want to play peekaboo and no one's playing with me right now. So I might have a meltdown. Also, another common function is escape. That is, I don't want to do this thing right now. You're making me do something I hate. I really hate the shower. Please don't make me do that. I'm having a meltdown on the bathroom floor. Showering is awful for me. Also, sensory is another possible function of the behavior. It may be, I want to escape the shower because I hate it, but I also might hate the feel of that water on my skin. Or I might hate the sound of the vacuum cleaner. That might be awful for me, and so I run out of the room. So we want to think about what the function is for your child's meltdown or tantrum behavior. And the reason is that function should guide the intervention. The function should help us figure out what we need to do to make this better for your child. And one of the first steps I always try to help families think through is, what can we do to modify the environment? There may be some ways we can tweak the environment, provide more structure, change something that's going on that will make this behavior less likely. For my little guy, my little 4-year-old who hated all of those WH questions that were too hard for him, for a little while, we stopped asking those WH questions that were too hard for him. We backed off. It was not as important to have him answer those WH questions as it was for him to be calm and be okay and be able to do other activities throughout the day. That's not the only solution. You can't just let them not do the things that they don't want to do, but it can be a place to start. We'll talk about some other strategies for modifying the environment in just a minute. You also really want to teach a substitute behavior. What would be a better thing to do instead of having a meltdown? What else could we do? And for the little guy, we eventually taught him a verbal response. Oh, not right now. That's a lot better than screaming and falling on the floor. And he could do that, and we could stop asking questions. So teaching him a more appropriate substitute behavior or alternative. We also want to reduce reinforcement of tantrum behavior. You guys don't want to reinforce tantrum behavior. I feel very confident. No one wants to be reinforcing tantrum behavior. But inadvertently, lots of times, adults, children, other people in the environment are reinforcing tantrums. Not knowingly or purposefully, but it happens. we'll talk about that in a minute. So, modifying the environment. There are lots of things we can do to kind of help provide our children with more structure, more support, and give them ways to better understand the world around them. Give them ways to better understand what's going on. When they have when things are more predictable, that can often lead to a reduction in difficult behavior. If you know what's next, you might not be as likely to freak out. I don't like not knowing what's next. If I don't know, I have to come in tomorrow and they added something to my schedule that wasn't there and I wasn't expecting it, I'm not going to be happy about that. I wasn't expecting it. I wasn't prepared for it. You've given me an extra thing to do that I don't have time for. That's not okay. This is something that applies to everybody. Our kids really thrive on structure and routine. It applies to them too. They don't want to be surprised. They want to know what's coming. So how we can figure out how to give them a little more of that. And some of the ways we can do that is to provide schedules. That might be a visual schedule. Sometimes our kids do okay with verbal schedules. That might work. That can often be routines. So routine-based activities. They know at nighttime I always go to the potty, get in the bathtub, put on my PJs, read a book, get a kiss, and go to sleep. And we do that every day. And that can really help calm stress and let them anticipate and know what's expected. Other things that can be helpful are timers. Has anybody ever used timers, tried timers? Did it work? Did it help? Depends on what it is.
Depends on what it's using.
Sometimes it can be really useful and sometimes maybe not. You can access one pretty easily. There's a bunch of free apps if you wanted a visual timer on your phone. I certainly have one that when it ticks out, it reveals like a duck or a transformer or a something. So if I know that we have to wait for 3 minutes before we're going to the next activity, I might put on the visual timer to say, okay, there's 3 minutes, and then your child's able to see and better anticipate, knowing the routine, what's going to come next. That might be enough to soothe some of that distress. Physical structure. This is a funny way to phrase something, but by that I mean how the room is laid out, what your child has access to, what you can get to, what's readily available, and sometimes just shifting that a little bit can be really useful. For example, in our classrooms downstairs, there is sometimes set up a little space for calming. And you could go sit in a beanbag and take a couple deep breaths and squeeze some squishy stuff. Sometimes classrooms have these set up too in the school system. Sometimes having a space for that can be helpful. And as a preventative way, you can change the environment and support this child. Another thing that is important for us to consider is that we are part of the environment. We are all part of our child's environment, and we can change some of our own behaviors to support them and set them up for success, so they're less likely to have a meltdown, less likely to have a tantrum, more likely to stick with you and do what they're supposed to do. And so some ways that we can help and change the environment are giving effective directions and providing plenty of kind of quality, positive feedback when they're doing well, when they're doing the right thing. So I'm going to talk about those in just a minute. Here are some examples of some of the visual supports that I have used, that I have had families have success with. I'm sure many of you are familiar with First Then. It can be a common can be a useful tool. First, you have to put your shoes on, then I can give you my phone. And using a visual support to make it even more clear to our guys who have trouble with communication and trouble with language can be extra helpful. This is just a picture of a visual timer. So this one reveals a robot at the end. And that could be set for anything, but I would start small. You're going to have to teach your child to know what that timer means. So you may need to start small so they understand what it means before you can use it for 10 minutes or before you can use it to have them wait for a long time or doing something boring. to be honest. This one in the middle, I just call it a visual countdown. I use this a lot, actually, and one of the advantages of this, as opposed to the actual timer that's actually like 3 minutes, is this can be on mom time, dad time, teacher time. This is your time. And I just have families say, okay, Johnny, you have 5 left to play with Thomas, and then we're going to eat. And then the 5 disappears. Make sure he sees it. Johnny, you have 4 left to play with Thomas, and then we're going to eat. It's not 4 minutes, it's 4 whatever times you need it to be. And then when they disappear, he sees that they're all gone, and that's going to give a clearer picture that, oh, they're gone, something else is happening now. When I have a kid who really needs a little more support, I'm going to put lunch here, or whatever the next thing is, to give extra visual support. Mine looks fancy. I use it all the time. Yours can be Post-its on a piece of paper. It doesn't have to be fancy. You could scrawl it on the back of a receipt. I have absolutely done that in public. That's fine. Exit out. If your kid understands this, they may be able to generalize and understand that just as easily. Okay. Pause. Sometimes when we have tantrums because we don't like to give up stuff, sometimes this can be a helpful tool. I will put it on a box. We'll use my cup. Okay. So if your child understands pause on the remote, it might be even more clear. But I will put the pause on, and I will say, okay, we're going to put mommy's phone on pause for a few minutes. You put it in there with the pause sign. You explain in advance. Pause doesn't mean it's gone forever. Pause means we're going to put it here for a little bit, and you can have it back in a little bit. It's like pause on the TV. You need to teach it first before they're just going to get it. So you have to practice this. The same thing with the countdown, the same thing with the first then, the same thing with the visual timer. It's important to teach these things for a while before it will be helpful, and your child will be able to use that extra support to make a tantrum less likely. Giving effective instructions. I catch myself not doing this perfectly sometimes, and I've been doing this for a long time, but oftentimes we overwhelm our children with verbal information. And we might need to take that back a step, give a very simple instruction in kind of a firm but neutral tone so that they can understand exactly what's expected of them. As opposed to, we're late right now, I need you to get your shoes and put your coat on, and I'm having trouble finding the keys, and like, your kid didn't get any of that. If you really want them to follow instructions and not get overwhelmed, it needs to be, go get your shoes, bring them to me. Wait, praise when they've done the right thing. Because otherwise, it's a struggle. Okay. Another thing we want to do to prevent difficult behavior and to modify the environment, aka modify our behavior, is to praise and reward when they're doing the right thing. I'm sure you guys have heard this before. It is hard to remember to praise the right thing. It is easy to immediately jump and respond when they climb on a table, or chuck something at their sibling, or scream in the store. You're going to respond to that within, 5 seconds? When they are playing nicely by themselves, when they are following instructions and putting their shoes on without help, you're less likely to be like, Johnny, you did awesome, thank you for putting on your shoes. But it's really important that our children with autism get a balance of both of those. Corrective feedback, and preferably much more positive reinforcement for doing the right thing. They need to hear what the right thing is. This just lists a bunch of ways to potentially reward your child. I want to get through some material, so we're going to let you read that on your own. So we can also, in the second step, as we've identified the function, teach a substitute behavior. So teach an alternative to the tantrum behavior. Teach them what they could do instead that would be more appropriate or that would get the same need met without having to be so dysregulated. Your kid doesn't want to be dysregulated. I am confident. It may seem like it sometimes on the floor that they're happy to be dysregulated, but I think they would probably prefer to be calm. So what can we do to teach? What can we substitute with? So I gave you the example of the little boy that I needed to teach. Not right now. There's lots of ways we can teach substitute behavior. For example, if your child has lots of communication difficulties and has trouble using words, we may need to use pictures or sign language to teach communication skills. And if they don't have those communication skills in picture or sign or words or with a device, then it'll be important to work with a speech pathologist or someone else who can support them getting their needs, being able to communicate what their needs are. Other things, we might need to just give them a social script, like a standard thing you can say in an upsetting situation. One of the things that's used in classrooms a lot is if another kid tries to swipe your toy, for preschoolers, the child who has the toy can say, 2 more minutes. That's an okay, totally appropriate response. 2 more minutes is fine. That's a good social skill. But they need to be taught a specific skill, like what exactly do I need to say in this social situation that's uncomfortable for me, that could lead to a tantrum. For our kiddos who are at the level where they might be able to understand emotions, we may need to teach emotion recognition so that they can understand what's happening in themselves and figure out what to do. So that kind of leads to all these coping strategies. Lots of times our kids do not just kind of innately develop coping strategies, they need to learn some of them, and so being able to recognize when I'm getting upset and escalating and then learning what I can do to calm down. Before we hop into how to teach a substitute behavior, I wanted to show you this graph. I will. And this is important. This is from a book by Brenda Smith-Miles, and I think it's a nice depiction of what happens in a meltdown. This curve at the top, that's the child. That's what's going on with them. There's teachable moments here where we are not escalated. We are calm, we're doing okay, we're ready to learn. Then we start rumbling. We might not be in full meltdown mode, but we're kind of edgy, agitated, maybe breathing a little bit faster, maybe not listening very well, maybe flapping. Yes. Then we get in full rage, and that's all the stuff at the top of the iceberg, throwing, kicking, falling on the floor, screaming. And then we're in recovery, which is kind of that period afterwards where we're still not ourselves. We might be more withdrawn. But the point here is that after recovery is another teachable moment. Your child is not ready to learn at all in the rumbling or rage or recovery section of this. So when they are escalated, throwing things and falling on the floor and whatever else this may look like, they are not able to take in and learn new information. They may be able to use some skills that they have overly practiced and are really good at. But they are probably not able to negotiate with you back and forth. They are probably not able to practice something new that they learned in therapy last week. They might not be hearing you, really. Another thing I like about this graph is that underneath is the adult curve. When our children escalate, we escalate. That's natural. That's what happens. And being aware that as they are edging up, we are edging up. Probably not to the level where they're going, but my body's getting tight and tense. This happens to me here sometimes. I know that I'm gonna have a kid who's gonna come in and I know he's gonna pinch and bite me and I'm not excited about it. I am not my normal calm self. I try to use my strategies and calm down, but I can feel in my body and know in my head that I am also edging up on this curve. Okay. So Some of those strategies we talked about a little bit, but teaching a substitute behavior, communication, like a sign for more. If the function is tangible, is to access something, we might need to teach. If you know the child wants to play, and that's why we're having a tantrum, because we can't play, maybe we need to teach the sign for play. Your child may also have a meltdown because they really don't want to do this math homework. It stinks, it's too hard, I can't do it. Meltdown. Maybe we could teach them to use a break card. That'd be a great alternative. Say, I need a break, take 5 minutes. Or ask for help. Sometimes when those escape maintained behaviors are happening, it's because I don't really know how to ask for help. But if I had a little picture with a cute penguin, maybe I would be more likely to ask for help if someone taught me how to use it. Okay. Another thing that can be helpful is social stories. Raise your hand if you've ever used a social story or someone's used a social story with your child. So these can be helpful for really clearly outlining what behavior is expected in a certain situation. It may be that your child doesn't know what to do, and teaching it and then practicing it in role play back and forth. It's silly, but it really is useful. Maybe the level of support that they need to not go smack and yell at a kid on the playground, but instead learn, oh, I need to say, do you want to play? And then hand them a toy. That would be a more effective strategy. We also may need to teach emotion recognition so that they can understand in themselves, when am I on red? And when I'm on red, what do I do? Because I need to do something different. Okay. And then teaching those coping skills. So to get to your point earlier, there's a lot of kind of different ways to teach coping skills out there. School counselors may have ideas. Therapists may have ideas. Some basic things about it are that I find coping skills to be most effective when they are over-rehearsed. So when I have the most success when every time I see this child, every week, the first thing we do is we practice our deep breathing, we do a little bit of stretching, we do our squeeze things, and we do that when we are calm and able to learn. We are in a teachable moment. We are not upset at all. I only teach coping skills when we are calm, not upset. And then I over-rehearse it. I practice it a ton. And having them practice that and then praising and rewarding them for using it. First when they're calm. You don't need them to use a coping strategy when you're calm, but you need them to learn to do it and to feel good about it when they're calm, because they're never going to use it if they're in a meltdown, if they can't do it when they're calm. Prompting coping skills in the moment, like do your deep breathing, usually goes terribly. That's usually a disaster. I occasionally have success. I basically never verbally prompt deep breathing. Sometimes, for some kids, I have taught a visual for deep breathing. For those of you in the back, it's a flower and a candle. Smell the flower, blow out the candle. And I have over-rehearsed and over-taught the flower and the candle from a picture. And so sometimes when we are in the escalating stage, not when we're full-blown meltdown, but when we're escalating, when we're rumbling, sometimes I can put this down, and sometimes that will work. I've had that be successful actually a decent number of times. I'm not verbally prompting it though. I'm also modeling deep breathing can be another useful thing, and I model loudly, There's also kind of a physiological component to if someone else is breathing really, really, really slowly, my breathing in the same general proximity tends to slow down a little bit. So I do a lot of modeling, but I basically never prompt deep breathing verbally. They hate that. Notes for teaching new skills. I kind of already covered this, but in the rumbling, rage, and recovery stage, we are not open for learning. That's true for me. I'm not open for, If I am having an argument with my sister and I have gotten to the point where my voice is getting faster and louder, I am definitely not learning. I'm not being a good listener. It's all thrown out the window. So you really need to wait until there's calm, preferably happy, for them to be able to take in information. Skills should be practiced repeatedly and regularly, and visual supports in role play may be really important. When I have success, it's because I'm using visuals and I've over-rehearsed it and I'm using role play too. I will even stage things that make you get upset. I will pretend with some children, okay, I know you hate it when I interrupt you. I have a 12-year-old boy who hates it when I interrupt him. Hates it. But sometimes I have to interrupt him because he talks at length for very long periods of time. And so we had to over-rehearse this because it used to be, I interrupt and he goes, "Ah!" That was not very functional. Not very useful, not socially appropriate. So we had to practice. Okay, so we're gonna practice today. I'm gonna interrupt. This is just pretend. I'm gonna interrupt. What are you gonna do? He's like, he knows it. I'm gonna take a big deep breath. I'm gonna say, I'll get to say it later. So we practice. This is just pretend. Can you do it? So he'll talk. He knows I'm gonna interrupt him. I'll interrupt, and he's like, and he can pull himself together. But we practiced it a bunch before he could do it by himself without me prepping him and telling him, this is pretend, I'm going to interrupt you. Doing it spontaneously in the moment, much, much harder than doing it with warning in a structured setting. Okay, in the meltdown moment. So we've talked about ways to be preventative, talked about ways to teach skills, and to change the environment to support your child better. In the meltdown moment, there's some things we can also do. I've already said this basically, but we need to minimize conversation and negotiation and probably speak in a neutral or quiet tone if you can. I know that this is not easy. And I know that as a professional, I might have your child in my session for an hour. Or as a teacher, I might have your child for, I don't know, 3 hours and a break and a little bit after that. You guys have your kids 24/7. So I completely understand that this is not always feasible. It's really hard to not get really emotionally involved in these meltdown and tantrum situations. But as much as you can, figuring out how to use some coping skills yourself, and that might mean you need to take some deep breaths, or you might need to trade off with another caregiver and take a break. We can also potentially use visual supports or modeling, like I talked about with the deep breathing. I try to really minimize all talking, but it may be helpful sometimes to validate feelings. Like, I know you're angry, I'm sorry. But that's it. No conversation, just I'm sorry you're angry. I'm sorry you're sad. So they know that you're with them, but I wouldn't go into launch into talking about it if they're still in that rage stage. You're not gonna make a lot of progress. You should absolutely talk about it in a teachable moment later when they're calm. You also may be able to relocate. Sometimes a shift in the environment can change the behavior. You could take a walk. I've had some families set up a little calm down space at their home somewhere. There's a little quiet corner. Maybe there's a bean bag. Maybe there's this pillow that we like, or a blanket that we like, or a snuggly, lovey toy. That might help if you can kind of silently, gently, physically guide towards the calm down space. Sometimes our kids are not going to let that happen, but for some kids it can be successful. You also need to be patient, use your own coping skills, take some deep breaths. Behaviors that can escalate tantrums. I should have let you guys guess these before I put them up. You guys know this. Yeah. If you yell back at your child, do they get louder or quieter? Louder. If you reward the tantrum behavior, if you take away the phone because it's time to eat, and they scream, "No, I want the phone back!" and you give the phone right back, you rewarded the tantrum. What's he going to do next time?
it again.
Do it again. We're totally going to do that again. That worked really successfully. That was an excellent strategy for me. I got the phone within like 10 seconds. It was awesome. Why on earth would I ask nicely or wait? That's stupid. Okay, negotiating doesn't usually work. Insisting on having the last word. You are the adult, but in these moments, your child is not logical. You can have the last word later. So the last piece, so those modifying the environment and teaching a substitute behavior, those are preventative strategies. Reducing reinforcement of tantrums, that is a consequence. So there's a lot of things that I could talk about here, but we don't really have time for them today. Some strategies that can be useful, especially if you know what the function is. So if you know that the function, back to our original discussion about figuring out the function, if you know the function, for example, is attention. Like I have a little guy that I see who he regularly drops to the floor and squeals, and his mom usually rushes over and like does something playful, like, oh, you're being so silly, tickles, or like, oh, let's swing, because she just wants him to get off the floor. This is embarrassing. But what do you think he's learning?
You get a reaction.
Oh, yes, I dropped on the floor and squealed, and I got awesome attention from mom. Let me do that again. And so he does. So if you know the function is attention, if you know that the goal is to get an interaction with you, then it may be really important to use planned ignoring. That's a purposeful strategy to not give attention when you know the purpose is to get attention and they haven't done it in an appropriate way. Other things that we can do to potentially reduce the reinforcement of tantrums are response cost systems, and basically that is taking away an item that was desired. That's particularly effective if, for example, we want the iPhone, we're screaming for the iPhone. We should not, in that moment, if the goal is access to the tangible item, access to the tantrum, then we should not let the child have the iPhone. We should see if we can get him involved in something else and try some other things. But giving that thing when the whole goal of the tantrum is to get the thing is exactly what you don't want to do. Okay, and timeout is a break from all positive reinforcement that is brief, typically. Planned ignoring. It depends on what the misbehavior is, like what the tantrum behavior is. And again, it needs to be related to the function. So if you know that he is doing this difficult behavior to get your attention, then it may be most effective to not give him attention, to not respond. Not forever, for a brief period of time. This is not forever. It's for a brief period of time, just not respond. And then as soon as he does something appropriate, anything appropriate, then you want to give praise and feedback and positive attention. So I am always, when I am observing tantrum, meltdown, difficult behavior, I am looking and thinking hard about where is the next appropriate behavior that I can hop in there and praise. I need to find something that this child is doing well and successfully, and I need to jump on that as soon as he demonstrates it, because I want to be giving positive feedback. I don't want to have to do a ton of ignoring. I do when I need to, but I would rather be able to praise the right thing so he knows what the right thing is to do, and use all the strategies that we're talking about to deal with those difficult behaviors. So for the sake of time, we're going to kind of move on through, because I want you guys to really appreciate the fact that dealing with meltdowns and tantrums and aggression and all the behaviors that you may be faced with is hard. It's hard to outlast a child. It's hard to be patient with a child. It's hard when it's repeated. It's hard when they don't sleep and you're exhausted. It's hard when you are working all day and come home and you want a minute to breathe and you don't have it. That's really hard. And you may need to really figure out how to support yourself, how to figure out what you can do for yourself to feel better if you've had a tough day, if your kid's being particularly difficult or challenging. I had a kiddo last week who was not a lot of tantrums, but just exhausting. I was just so tired by the end of 2 hours. I was like, I'm just done. I don't know how his mom does this. I'm so tired. And I worked hard for 2 hours. I got what I needed to get done. We accomplished some things. And I took a break, went to Starbucks, got a coffee I would normally not spend money on because I needed to treat myself. And you guys need to do that too. You need to figure out where in the day, in the week, you can do something for yourself, because managing someone else's difficult behavior all the time is exhausting. And self-care is really important. Jacob is a kiddo who loves to kind of give you the sneaky look. Like he'll go do something kind of disruptive, like swipe a table and then give you the sneaky look. Or like chuck something kind of gently and give you the sneaky look. What might be the function of that behavior? My choices were tangible, access to an object, attention, escape, or sensory. What might be the function of his behavior?
I was saying attention.
Yes. It's probably likely that because he's looking back at you with the sneaky face, this is attention-based. So what might be, we didn't talk, it's a hard one actually. How maybe could I modify the environment? I'm Jacob, I'm his caregiver. How could I change something about me to modify the environment?
Give him a schedule of when he's going to get one-on-one adult attention with the caregiver.
Beautiful, yes. I could schedule more attention with me. He might need a higher level of attention with me. He might need me to check in on a regular basis and like talk to him and play with him and do something silly. What substitute behavior could I teach him?
Some other things that
I could teach him independent play skills. I could totally teach him independent play skills. The function's attention. What could I teach him? What else could I teach him?
A script to say, look at me.
Yes. So I could give him a script or use a social story to say, hey, can we play? Want to play? Let's do something. That would be a good substitute behavior, as opposed to sneaky throwing things. Asking me to play in an appropriate way would be a great other behavior. What can I do to reduce the reinforcement of tantrums in the future?
So when he's doing something that is not that, give him extra praise.
Yes, give him praise anytime he approaches you in the right way. Like, hey, let's go play. Give him praise for that. What else? What else should I do to reduce the likelihood that this is going to happen again in the future? I'm his caregiver. He's over there throwing things and like giving me the stink eye. Should I respond? Ignore. I can't respond. I should not respond if he's giving me the stink eye and throwing stuff. He's doing it to get my attention. That's not the right way to get my attention. I want to figure out, my brain is now ticking, my clock is ticking, what can I find to do that would be appropriate? Like that he's doing that I can praise, that's appropriate. Okay, so that's the process that I go through when I'm trying to figure out how to deal with tantrums and meltdowns. And this is kind of the end, but be kind to yourself. You need to be aware of your basic needs. Lean on others for support. Potentially figure out how to use some other strategy, mindfulness, gratitude, figuring out the small glimmers and strengths that you see in your child and like becoming really aware of those, making sure to think about it every day. You may also need to find a support group or consider respite. Sometimes tantrums and meltdowns are completely exhausting, and you may need a break, and that may be respite. Okay. Uh-oh, we're stuck again. We're kind of out of time. I ran a few minutes over. I could take maybe 1 or 2 questions.